Early cancer detection. 8 signs you should never ignore. Cancer is a disease everyone fears, but it doesn't have to spell doom. Early detection can mean the difference between life and death. By recognizing warning signs, you can seek timely treatment and potentially save your life or the life of someone you care about. This video lays out 8 critical signs of cancer that you should never ignore. These symptoms may seem minor, but they can contain vital clues about your health. We'll walk you through each of these signs clearly and concisely, empowering you with the knowledge to stay ahead. Importantly, while these symptoms do not always indicate cancer, if something feels or looks wrong, it's crucial to consult a healthcare professional. Let's dive in and learn what your body might be trying to tell you. The human body is remarkably intuitive. It often warns us when something's wrong. However, the signals can sometimes be subtle or mistaken for less serious issues. Early detection doesn't just improve survival rates for cancer. It also makes treatment simpler, less invasive, and more effective. Listening to your body is the first step. Unexplained symptoms that linger or worsen over time aren't something to brush off. The goal here isn't panic, it's proactive care. By learning about these warning signs, you can take control of your health and respond appropriately. Losing weight without trying to is often seen as a good problem to have, but not when it happens unexpectedly. If you've lost more than 10 pounds without changing your diet or exercise routine, this could be a red flag. Unexplained weight loss is sometimes the first noticeable symptom of cancers like stomach, pancreatic, or lung cancer. When cancer cells consume your body's energy supply or disrupt your normal bodily functions, it can result in significant weight loss. If you're experiencing unexplained weight loss, it's vital to get checked. While stress or other medical conditions may also play a role, it's always better to err on the side of caution. We all get tired now and then, but persistent fatigue is different. It's the kind of exhaustion that doesn't go away with rest or a good night's sleep. Cancer-related fatigue often occurs because your body is working overtime to fight off illness. Blood cancers, like leukemia or lymphoma, can cause anemia, leading to this type of exhaustion. Fatigue may also be caused by cancers that disrupt normal organ function. If you're constantly feeling drained without an obvious reason, it's worth discussing with your doctor. Early detection may allow you to address the root cause quickly. Your skin can be a window into your overall health. Changes such as unusual moles, persistent itching, or skin discoloration shouldn't be ignored. Melanoma, a dangerous form of skin cancer, often begins as a mole that changes in shape, size, or color. Watch for moles with irregular edges, uneven coloring, or those that seem to grow larger over time. Additionally, unexplained redness, darkened areas, or jaundice, yellowing of the skin, can signal various internal issues, including cancer. Monitoring your skin regularly and consulting a medical professional about any changes can help catch problems early. Finding an unusual lump can be alarming, and it should be. While not all lumps are cancerous, those that persist or grow over time need evaluation. Lumps under the skin are a common early sign of cancers like breast, testicular, or soft tissue sarcomas. These lumps may not cause pain initially, but their persistence is what makes them concerning. Don't ignore lumps because they're painless or small. Bringing up your concerns with a healthcare professional can rule out or confirm any underlying issues. A lingering cough that doesn't go away or frequent episodes of hoarseness should not be ignored. Coughing occasionally or due to a cold is normal, but when it becomes persistent, it could be more than just a respiratory infection. Lung or throat cancers often present early symptoms like these. If you notice blood-tinged sputum or worsening hoarseness, it's a strong indication to seek medical advice immediately. We often underestimate the significance of chronic coughs, attributing them to allergies or minor infections. However, early action can lead to earlier diagnoses and treatment if something is wrong. Your daily bathroom routine can provide key insights into your health. If you notice unusual changes in bowel or bladder habits that last more than a few weeks, it could indicate something serious. Persistent diarrhea, constipation, or a feeling of incomplete bowel movements can sometimes point to colorectal cancer. Similarly, blood in the urine or frequent painful urination can be linked to bladder or kidney cancers. Keep an eye out for patterns. While occasional changes aren't uncommon, persistent issues warrant a discussion with a medical professional. The body is built to heal itself, so when a wound or sore lingers for weeks without improvement, it's often a sign that something is interfering with the healing process. Non-healing sores, especially in the mouth or throat, can point to oral cancers. Smokers and heavy drinkers are particularly susceptible to these types of cancer. Take note of any patchy areas, ulcers, or sores that bleed easily or refuse to heal. Seeking medical advice can help you address potential issues early. Unusual bleeding or discharge is one of the most noticeable warning signs and should never be ignored. If you experience bleeding between periods, after menopause, or during urination or bowel movements, consult a doctor. These symptoms can be associated with cancers such as cervical, uterine, or colorectal cancer. For example, coughing blood could signal lung cancer, while abnormal nipple discharge could suggest breast cancer. Staying vigilant and reporting these symptoms promptly can make all the difference in outcomes. Recognizing these signs is an important first step, but acting on them is equally critical. If you experience any of the symptoms mentioned, don't wait for them to escalate. Schedule an appointment with your healthcare provider to discuss your concerns. It's better to have a potential issue ruled out than to ignore something that requires attention. Doctors are partners in your health journey, so keep communication open and advocate for evaluations and screenings if necessary. It's natural to feel anxious about symptoms like these. However, it's important to remember that they don't always mean cancer. Many of these signs can be caused by less serious conditions like infections or chronic illnesses. That said, it's never safe to dismiss persistent or worsening symptoms. Early action allows for earlier intervention, and in many cases, this can simplify the treatment process. Think of this as precautionary, life-saving care rather than unnecessary worry. You don't need to wait for symptoms to start prioritizing your health. Regular checkups, self-examinations, and cancer screenings are powerful tools for prevention and early diagnosis. For example, annual skin checks, mammograms, pap smears, and colonoscopies are essential for catching cancers early in their most treatable stages. Healthy lifestyle choices, such as maintaining a balanced diet, exercising regularly, and avoiding tobacco or excessive alcohol, can also reduce cancer risks significantly. Cancer is a frightening word, but it doesn't have to be a death sentence, especially when caught early. By paying attention to your body and seeking medical advice promptly for any unusual symptoms, you take a crucial step in protecting your health. To recap, the 8 signs you should never ignore are: unexplained weight loss, persistent fatigue, changes in your skin, unusual lumps or swelling, persistent cough or hoarseness, changes in bowel or bladder habits, wounds or sores that do not heal, unusual bleeding or discharge. If any of these signs sound familiar, don't panic. Instead, take action. Share this information with friends and family to spread awareness, and together, let's work toward a healthier, more informed future. Staying empowered and informed is the first step to staying ahead. Remember, looking after your health means listening to your body and acting when something feels off. Make your health a priority. It could save your life. Let us know your experiences in the comments section. Give it a thumbs up if you enjoyed the video. Subscribe for more health tips.